and welcome on behalf of Medscape. I am Dr. Kathrin LaFaver, a neurologist and lifestyle medicine specialist in Saratoga Springs, New York. And I have the great pleasure of talking with Dr. Soma Sengupta today, a clinical professor of neurology, who is also the division chief of Neuro-oncology and vice chair of research for the Department of Neurosurgery at University of North Carolina at Chapel Hill. Welcome, Dr. Sengupta.
Thank you, Dr. LaFaver. It's a pleasure to be here today.
The topic we're going to talk about today is integrative medicine in neuro-oncology. To start us off, I'm very interested to hear more about where your interest in integrative medicine came from, and also hear about the training you did. I understand you completed a fellowship in integrative medicine.
I'll start about the fellowship first, and then come full circle to my interests. So I did my fellowship in integrative medicine at the Andrew Weil Integrative Medicine Center. That's linked to the University of Arizona. And I became very interested in integrative oncology through my training. And Dr. Abrams at UCSF and Dr. Lise Altschuler at the University of Arizona and at the Andrew Weil Center really got me hooked into the area. I was very taken with the approaches to improve the quality of life of cancer patients. And the reason I became interested as a neuro-oncologist, I often didn't like the approach that I was trained to do, which was you give chemotherapy, you take care of their day-to-day chemotherapy needs and monitor the patient. And then you didn't really offer anything else in terms of lifestyle advice. So I went to clinic as a fellow at the Mass General, Dana-Farber, Brigham Fellowship in Neuro-oncology. And I noticed that one of my mentors, Dr. David Reardon, would talk about nutrition and exercise to his patients. And I thought, wow, this is an interesting approach. I noticed that patients were always asking for that additional angle. What if I took this supplement? What if I did this herb? What if I did this exercise? What if I did? And there were lots of what if I dids. And as a clinician scientist, I learned very early on that you should never disregard data points. So if patients were asking for these alternative approaches, I needed to be educated in them. And I felt that the best way to be educated was to embark on a fellowship. And I was very fortunate that the Schiff Foundation, when I was at the University of Cincinnati, paid for me to do the fellowship in integrative medicine. And so learning from all my mentors at the Andrew Weil Integrative Medicine Center, including the ones I mentioned, Dr. Altschuler and Dr. Abrams, was just a life-changing experience. And of course, Andrew Weil himself is such a legend in the sphere of integrative medicine, and the way mindfulness, nutrition, supplements can really impact the way that people can live. And so I applied it to the sort of brain tumor and neuro-oncology space.
Wonderful. Well, that's a good segue. Why don't you tell us more about the program you have started for your patients with brain tumors?
So Dr. Abrams let me sit in on his integrative medicine group visits in the integrative oncology setting. So at the University of North Carolina, I offer integrative oncology virtual group visits that are billed, but at a low tier. But each week is a different theme. So I have a 5-week series, and up to 12 patients can sign up. And each week I have a different expert with me. So, for example, the current series that I'll be running will have a pharmacist who's integrative medicine trained and will be there to discuss herbs and supplements. And then we have a break-off session after the talk as to what kind of supplements might be helpful. And if patients have one-to-one questions, we can utilize the breakout rooms. Often my groups of patients have not wanted this. They've been more than willing to discuss things. The other week is going to be on mindfulness. And we have a mindfulness expert who's NIH funded in the area talking about this. And then we will break away and do mindfulness exercises and also talk about ways to implement mindfulness in each patient's lifestyle. We have nutrition. So we have a naturopath who has worked in the space of integrative oncology for many years, discussing that. Then we have somebody who's a nurse practitioner in integrative oncology who will discuss exercise, and she directs the integrative oncology program at the Lineberger Comprehensive Cancer Center. And then I do a segment on mushrooms and supplements again. And we then sort of tie everything together and ask whether there is anything that people want to know more about. Each clinic visit has notes that go into Epic so that the patient can access all these resources at their own time when they want to look things up through MyChart. So it is a comprehensive program, and it repeats itself after. So a 5-week series, there's a week break, and then it starts up again so that other patients can join this. And what I found is that it's not only useful from an integrative medicine standpoint, it's also very useful as a support group. So the groups of patients begin to know each other. Some of them open up to each other. And then after the series is over, sometimes they connect with each other. I utilize a HIPAA compliant Zoom platform, and that is provided through the institution. And so far, it has been very rewarding for me.
That sounds wonderful. And I mean, certainly, as you mentioned, very, very comprehensive approach to really looking at different aspects that could help with people's coping skills and general quality of life. And what are some of the feedback you have gotten from patients? And are you measuring outcomes in any more systematic way? But yeah, I'd be interested to hear more about the feedback from people.
Several patients have wanted to do it again. I've had one that did the series 3 times because they find that the information is never the same repeat, right? So there's always more information to learn, and other people are joining. And so in terms of outcome measures, my hope is to eventually, with one of the providers in the group, actually the mindfulness expert, she and I are planning to submit an NIH grant exactly on mindfulness. Just taking one of the angles and going further with it. And then on the supplement side, there are things that I'm interested in, but not necessarily for this angle. But I think that really understanding how, this series can help patients, how we can implement mindfulness, how we can do mindfulness in a virtual setting is helpful.
I'm really happy to hear about your plans and good luck with the grant submission.
Thank you.
So you touched on that a little bit already, but tell us a bit more about your decision to offer this as group visits and maybe some tips and tricks for people who are trying to offer group visits in their own setting. There were some surprises as you're planning this or anything else you learned.
So I was very fortunate in the Andrew Weil Integrative Center fellowship. They had a whole section on group visits, so that helped. And then when I came to UNC, one of my colleagues in PM&R, she was already doing integrative medicine visits for patients with chronic pain. So I was able to do some modeling and get a lot of support from my colleagues within UNC. They're generously offering their time. it's a question of having a system that's willing to support this. My colleague at the Lineberger Cancer Center, she offers the one-to-one visits. And these are usually, it could be 60 to 90 minutes. And a lot of patients have told me, especially the brain tumor group, that this is difficult for them. They don't, they have so many hospital visits, so many doctor's appointments. They don't want to do that as well. So is there another way of doing this? So that's why I offered this strategy of the group visit, because it's information that would be beneficial to a number of different patients. In terms of time conservation, it's a better way for patients to get things they want. And also this way, they are able to use my colleagues' resources within the cancer center more efficiently because they know what they want once they've done the series.
It sounds a lot more doable and less overwhelming as for a number of reasons, as you pointed out. Well, I really love this, and it's a really, really excellent demonstration of an innovative new way of bringing this type of information to more people while also supporting them. As you mentioned, there's this support group aspect. Well, I really congratulate you on this starting this fabulous program. So where can people go if they want to learn more, either about integrative medicine or maybe starting group visits for patients? Do you have any resources you can share?
Yep. So the Andrew Weil Integrative Medicine Center has quite a few resources that are free. If you link up to my name on the website, UNC website, they can see the format of the group visits. And there are group visit providers throughout. So as I mentioned, my mentor, Dr. Abrams at UCSF, a radiation oncologist there that works, is also doing integrative brain tumor visits as well. There are more of us that need to offer these resources. And I think that it would be very useful not only in the brain tumor space, but in the neurology space in general. But each of these group visits needs to be tailored to the disease, right? So you can't really do an integrative oncology group visit for migraine sufferers, for example. That needs to be tailored towards migraines. And it needs to be a provider that understands the pathophysiology of the migraine sufferer well. There's a lot of potential for this, and trying to work with foundations, patient advocacy groups to increase the reach of these resources would be incredibly useful.
Absolutely. Well, you're an inspiration. Thanks again for sharing this. So this was Dr. Soma Sengupta talking to us about integrative medicine approaches for neuro-oncology. Thank you all for watching on behalf of Medscape, and have a good rest of your day.
Thank you very much. Bye-bye.